What's new from Apple? There's the new iPhone 16 Pro, built for Apple Intelligence. And it comes with the all-new camera control, giving you an easier way to quickly access your camera tools. The new Apple Watch Series 10 has our biggest display and our thinnest design ever. And this? It's the sound of active noise cancellation, now available on one of 2 new AirPods 4 models. So quiet. Check out all of the new products and new features at apple.com. You can even buy yourself something new. See apple.com for product availability updates. Apple Intelligence coming this fall.
Earning your degree online doesn't mean you have to go about it alone. At Capella University, we're here to support you when you're ready. From enrollment counselors who get to know you and your goals, to academic coaches who can help you form a plan to stay on track. We care about your success and are dedicated to helping you pursue your goals. Going back to school is a big step, but having support at every step of your academic journey can make a big difference. Imagine your future differently at capella.edu.
With Walmart's new fresh and frozen subscriptions, you can save time on your weekly grocery shopping.
Dad, you're supposed to be grocery shopping.
And miss the chance to embarrass you in front of your friends? I subscribe to snacks and wet napkins. You know how messy you are.
Dad!
Walmart. Subscribe to your weekly list.
You see? Your stupid minds. Stupid.
Man, you are one pathetic loser.
You get nothing. You lose. Good day, sir.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by 2 really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valves, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic echographic and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease. So I'm paging Dr. Steve. Dr. Steve.
From the world-famous Elias from Kentucky studios. It's a long story.
Long story.
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio. Now a podcast. I'm Dr. Steve. With my little pal, Dr. Scott, the traditional Chinese medicine provider, gives me street cred. The whack alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things, Tacie. Hello, Tacie.
Hello.
This is a show for people who never listened to a medical show on the radio or the internet. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-768-4323. That's 347-
Poohhead.
Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we're not your medical providers. Take anything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over first with your healthcare provider. Don't forget to check out stuff.drsteve.com, stuff.drsteve.com. I'm not going to beg, but I'm going to ask you to go to stuff.drsteve.com. Click through to Amazon when you're going to buy something, or scroll down and see what we got on there, because there's some interesting things there. Plus, it really helps to keep us on the air, including the Rode robotic guitar tuner, which is amazing. And check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. Check out Tacie and me on patreon.com/Weird Medicine, where we do special shows. Dr. Scott and I may be doing a special Patreon show this weekend because Tacie's going to be out of town.
Oh, yeah.
So it might be a music show, though. Carl knows that those don't go well, but we're going to do it anyway. And then cameo.com/Weird Medicine. I'll say fluid to your mother, or whatever else you want me to say within reason. Now, the reason I said for the Elias from Kentucky broadcast network is because Elias from Kentucky is listening, and he is 13 and started school.
Yeah.
Why his mom lets him listen to this?
Because she's awesome.
Horse doo-doo. I do not know, but we do appreciate him listening, and we appreciate his mom too. And that's about it. Well, check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net, where you can find the best CBD nasal spray.
Yeah.
Actually, the only CBD nasal spray that I've ever seen.
Yes.
And we've got someone in the YouTube channel, the Fluid Family, named Diesel Child, and he or she, I'll just say they, apparently bought 6 bottles of that crap from you by going to simplyherbals.net. And I give Scott a hard time. It's not crap. It's actually awesome. It's you say some silly things on this show sometimes.
Oh, yeah, of course.
But that stuff is the bomb. So we're not supposed to actually be selling things, but check it out at simplyherbals.net. That's his website. Anyway, yeah, very good. Okay, man. Proud of you on that one.
Thank
Best
you, sir.
delivery system ever. Now, NP Mel B was going to be here today, and she had to fink out because she had to have dinner with her mom. And PA Lydia was going to be here today, but what is it? She got drunk and ate a hot dog in New York City or something? What the hell was that
I don't
about?
know. I was
still hung up.
paying
Still hung
attention
over.
to your all's
He's still hung over, I think.
bullshit on that
And then
text thread.
DNP Carissa had a headache and took drug for the first time. Then she just woke up a second ago. So.
Poor thing.
Anyway, we're going to put them back on rotation, and hopefully now that NP Mel B's business is straightened, and she'll talk about it, and Tacie, you and she have a lot to talk about because she feels the same way about endocrinologists that you do when it comes to thyroid stuff.
Yes, exactly.
And I'm just going to blow up her spot a little bit. What her point is that they look at numbers and they go, oh, well, your thyroid stimulating hormone is a little bit low, so we need to back off on your thyroid hormone. And she's saying, I feel good for the first time in 10 years, please don't do that. And they did it anyway.
No.
And Tacie's had the same problem, right?
I got up and walked out when a physician was talking to me about depression when I was trying to tell him I felt like crap because of my thyroid. I know the difference.
Right.
So
Right.
I just got up and walked out because I was wasting my time. And
Well, tell us the story a little bit. So let's talk about the symptoms of depression.
Okay.
Anhedonia, the inability to enjoy things, right? Apathy, the inability.
Did you know that anhedonia was my ex-wife's middle name?
That's a pretty good one.
I knew it.
Yep.
Give thyself a bell.
That was, you deserved that
Give thyself a bell.
bell. Not two, though.
Yeah, that was good. I'm sorry.
She doesn't listen to this show, does she?
I hope she does. She probably does. Knowing her, just for the torture. So I'm sorry, Tace. I didn't interrupt you.
No,
No, you didn't. That was good. That was funny.
Yes.
My middle name's Anhedonia.
Blank Anhedonia blank.
Well, her first name was Anne and her middle name Hedonia. So. Anyway, that's not even good, but it would work.
It would make sense, though. It would explain a lot of things.
And, the Anne in front of, so hedonism, that's where this comes from. The word hedonism means to enjoy everything and to kind of overdo it. And then the Greek A in front of it, but you wouldn't say ahedonia, so we'll add the N sound to split up those phonemes. So anhedonia means not enjoying things.
Yep.
Okay, so but that's the root word.
Interesting,
Hedonism, and for hedonism and anhedonia are the same. So anhedonia, apathy.
Right.
Let me see. What else? Change in eating habits, change in sleeping habits, depressed mood, those kinds of things. That's not what you were having, right, Tace?
No.
What were you having?
I was exhausted all the time.
Fatigue.
And I could not.
The one thing that was in common between depression and this.
I knew something else was going on, and my numbers were. They had told me that I had Hashimoto's. And
tell everybody what Hashimoto's is, because they got to get on the same page.
It's just when your thyroid's screwed up.
Okay,
I mean, your thyroid doesn't work anymore.
Give thyself a bell.
And at first it works too good, and then it won't work at all, and then it's back and forth and back and forth and back and forth until it just
It's an autoimmune disorder where the thyroid is attacked by your own antibodies, which initially causes it to be stimulated and maybe produce too much thyroid hormone. And then when it finally kills the thyroid, then this is oversimplified, but when it finally kills the thyroid, then you're producing too little.
Right.
Yeah.
Right? So tell us what you felt like. Just give us the experience that you had with the endocrinologist.
Okay, my anxiety was through the roof. I mean, I couldn't hardly function, and I was exhausted at the same time.
Yeah.
So I walked in to see him, really hoping for some help from this quote-unquote specialist.
Correct.
And my family practice physician knew more than he did, and he treated me by a number.
And your evidence being what? What did he do?
My evidence being how I felt.
No, I'm saying your family practice provider knew more than this person as far as treating you. What's your evidence when you say that?
Well, because
That's
she
one
made
thing
me
to
feel
say.
good. He did not.
Okay. And what did he do?
He didn't do anything.
Pissed you off.
Well, if he didn't do anything, you wouldn't have walked out. What was
Well, he
the
said,
conflict?
don't let depression get you down.
Mm-hmm.
Your numbers are fine.
There you go. That's the key. So what he did was he looked at you as if you were a number on a piece of paper rather than looking at the whole person. It's called a holistic approach to medicine. And we're not talking about holistic medicine. That's Dr. Scott's bailiwick. What we're talking about is looking at the whole person.
Right.
And people are not fucking numbers on a piece of paper. Men have the same thing.
Yes.
When they go in and the range of testosterone is 300 to 800 and your testosterone is 301 and they go, well, you're normal. That's in the normal range, so ain't nothing wrong with you. That it is such bullshit, because what they're doing, Tace, is confining you to 1 or 2 standard deviations on a bell curve. But the reason we have fucking bell curves is because there are people that live on the periphery.
Right.
And that's why you have a bell curve. Not everybody has to be confined to 1 to 2 standard deviations. You got to use your I'm mad today. You got to use your head.
Yes.
When you're looking at these things. And it's just like my no, it's as if you had an employer that said, we're going to only pay you, if you're on productivity, for example. We're only going to pay you 2 standard deviations above the mean. Anything above that, we're just going to cut it off. It's stupid.
It's just stupid, yeah.
You work till September, and then you're off October,
Right.
November,
Yes,
December.
it's idiotic.
Yep.
And when you look at testosterone particularly, how do they determine these normals? This is the problem with these quote-unquote professionals, is they've forgotten their math and they've forgotten the where these numbers come from. They don't just, these ranges aren't just set in stone. They are determined empirically. In other words, you get 1,000 people. Let's do testosterone first, then we'll do the thyroid.
Yep.
You get 1,000 people and you test them all for testosterone. And then you take the mean of those numbers and you go 2 standard deviation, just a simple mathematical thing, and you go, that's the normal range.
Right.
We're going to agree that 2 standard deviations from the mean is normal. Well, the problem with that is that a lot of people are walking around with undiagnosed low testosterone, and they are included in that.
And they're miserable.
But they're included in that calculation, so it's skewing the normal range down. And so you are including people with low testosterone. Whoa, what was that?
I don't know. Wasn't me. I didn't touch anything, I swear.
I didn't touch anything.
Okay,
either.
all right. Maybe it's just my brain
Ghost.
getting ready to explode. It's skewing the normal range downward, and so when you have a provider, and I'm looking at you, nurse practitioners and PAs too, when I talk about this, that says, well, 301's normal, but 299 is abnormal. But you've got somebody, let's say they're 350, but they have all the symptoms.
Right.
They're low testosterone. We're talking low testosterone here. Fatigue, erectile dysfunction,
insomnia.
Sure, insomnia is a big one.
That's what mine is. Yeah.
And they also have physical weakness and loss of libido, et cetera, et cetera. But you're telling somebody, oh, no, you're normal, so I'm not going to treat you. Right. You're an asshole.
Yep.
And it's the same GD thing when you have somebody with thyroid disorder and you're confining them to 2 standard deviations from the mean, whereas you and Mel B both are slightly different and you need a slightly different number. And you know, the other thing is when you get a number that is abnormal, what's the first thing you do? Scott, and you're not a clinician in this sense. What's the first thing you do when you get an abnormal test result?
Recheck it.
Thank you. Okay. Whoops. Oh, shit.
Oh, he's giving bells out like
yes.
They're coming out of style.
Why can't I hear
I love it. I can hear a bell in my head.
Give thyself a bell.
Oh, there's your bell. All right. I got it fixed. Anyway. So, what were we talking about? Where were we in that conversation before I went
Something
looking
about
for...
deviated standards
from the norm right on.
Deviated somewhere.
A deviated septum.
Yeah, you guys are just different. You need to be treated like people, not numbers on a piece of paper. That's all I'm trying to say.
And I like to add to that too, Dr. Steve. You know, 50 years ago, which is not that long ago,
right?
There weren't computers saying, well, you know, your thyroid's this, and you know, the providers used to go, oh gosh, you have these things, you must have blank,
right?
And didn't necessarily need a lab value that was generated through a computer,
right?
That says, hey man, you get this stuff. So I think the biggest take
We've
home
lost
from this
our
is people
ability.
need to listen.
Yes, thank you.
And pay attention.
I'm not giving you another bell for that. I agree with you 100%, but it's 100% right.
Yeah, because people like Tacie, you know, the benefit Tacie has is, first of all, she's smart. She knows her body. She pays attention, and she can articulate. You know, but think
Didn't
about
help.
But that's my point. But think about the folks that don't have her knowledge of medicine.
Yeah.
I mean, hell, they're just walking out. They're walking out there going, well, I guess I ain't got that.
Yeah,
you know,
I guess I'll just feel like shit.
Well,
I guess I'm supposed to feel terrible.
They told me 301
I'm
normal.
I'm normal. Yeah, it beats all ever. So.
Yep. Clinicians out there, look at your patient. Okay, I'm going to tell you a story. The year is 1987. I am an intern in family medicine, rotating on internal medicine.
I am 13 years old.
Okay, fuck off. Nope, whoops, wrong.
Can you, shut up?
So anyway, actually, let's amend that. It was 1986, so you were 12. And, which, by the way, I told her dad at one point, thanks for being such an asshole. Mm-hmm. And he was like, well, okay, what do you mean? I said, well, if you had invited me over to your house when I was an intern, like these other people I won't name, because it'll dox everybody. Sure. But like this attending and that attending who had us over for barbecues and stuff like that. Instead, you were an asshole who tried to keep me out of the doctor's lounge, and you didn't want to have anything to do with us unless it was 2 a.m. when one of your patients died, which they always did, and I had to go pronounce them. If you'd been a nice person like that, I would have met Tacie when she was 12, and when she came into my office at age whatever it was.
One or
well, no, she's older than that. Then she would have been off limits.
Yep.
Because I would have gone, I met you when you were 12.
With your diapers, yeah.
Yeah, but
weird.
Instead he didn't, and here we are. But anyway.
There you go.
So, what was I going to talk? Oh, no. So, okay.
1986.
Fuck
yeah,
off.
you got a story. 1986. You were a resident.
Yes, I'm just rambling. That's
internal
what I do.
medicine.
So 1986, got a lady in the intensive care unit. Her legs are mottled. Her blood pressure is 70 over nothing. And she had what we called then bacteremia, which we now call sepsis.
Okay.
And it was pretty obvious. And she had stage 4 cancer, not obvious, not going to make it. But she had a slightly elevated creatinine, which is a sign of kidney failure, and her potassium was 6. Now, that's what we call a panic value when your potassium is elevated, because the body usually is just in its homeostasis. In other words, it's desire to keep everything on a normal level and compensating for changes and stuff like that. It wasn't able to do that anymore. So my chief resident, who will also remain nameless, looks at this and goes, okay, and he starts firing off orders, right? Ding, 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 ding. Give some furosemide IV. Let's do K-Exolate, which is a potassium retaining resin. Give her a K-Exolate enema. We'll do this, and that. And maybe some calcium, if I remember right, intravenous. And we moved on rounds. Well, that afternoon, when we did afternoon rounds, he looked at her labs, and it showed a potassium of 4.2. And he's like, yes, and he's strutting up and down the ICU, punching the air as if he'd actually accomplished something. And this went on.
Oh wow!
For several minutes,
showing off how smart he was.
Yeah,
or she was.
Yes, and punching the air, and I'm like, dude. You're not looking at the patient at all. You are literally looking at a number on a piece of paper and congratulating yourself. And, she passed away that night, as everybody kind of knew that she was going to. And, it was a little bit later, I saw a movie called My Dinner with Andre. Have you seen this movie?
No, I've never heard of that.
It's Wallace Shawn, and can you look it up? I can't remember the director's name. It wasn't Andre Previn. It was a different Andre. And Wallace Shawn did this movie.
My Dinner with who? I'm sorry.
My Dinner with Andre.
Gotcha. Well, hellfire.
It's a little short-term memory loss there.
Just a little.
Literally 4 seconds ago. But anyway, My Dinner with Andre, and it is 2 hours almost of Wallace Shawn and Andre so-and-so eating dinner, and them just having a conversation. And at one point during this, Andre, the director, is talking to Wallace Shawn, the actor, and you know him, right? It's Wally Shawn, the guy from, It's Inconceivable from the Princess Bride.
Princess Bride, yeah.
And but Andre's talking about when his mom was in the hospital, and if I remember correctly, she had stage 4 cancer, similarly dying in the hospital, but she had fallen and broken her wrist, and the orthopedist had splinted her wrist or cast it or whatever, and he came out and talked to Andre and said, "Yeah, she's doing great. She's doing great." All he looked at was her arm.
Right.
This patient, elderly woman, dying in the hospital, and he comes out and says she's doing great because he had looked at the cast on her arm and he had done his thing, and it was a good job. Did you find out who Andre is?
No.
Oh,
but I will tell you this. I will tell you this. Hey, well, hang on.
Andre Gregory.
Yeah, there you
Wallace
go.
Shawn.
Well, I was reading.
Andre Gregory.
Rotten Tomatoes gives it a 92%. So
Yeah,
that's been a really good movie. Yeah,
it's an awesome kind of art film.
Yeah,
you have ADHD too.
Yes.
He got caught up in the.
I told somebody the other day. I said the only person I know with worse ADHD than
is me.
Him. And us two together. Poor Tacie.
Like, Scott's reading the review.
Tacie needs
this thing got good reviews. It was a sort of a seminal art film, existential film, where it's just two guys talking for an hour and a half, and that's it. And it was really Is
it sad or is it?
No,
it's really compelling.
It's sad and it's funny.
Okay,
it's compelling. It's crazy.
Okay.
It's Wally Shawn.
Oh, he's
so
awesome.
Who doesn't love him?
It would be inconceivable not to like him.
Right. Yeah. But anyway, But so same sort of thing. And back then, when was that movie made? Does it say, Dr. Scott, when
Okay,
it was made?
I'm on it.
Okay, no, I'm going to beat you. Hold on.
It was about the
81.
same time. About
Damn
the
it.
same time. So
Damn it, she's right.
I don't think I saw it until after this thing had happened, but it was contemporary. It was in the same decade. And that was what was going on in medicine right then, as we were just looking at our own little pieces, and we were looking at people as numbers on a piece of paper. And sadly, for Tacie and NP Mel B and countless dudes who have low normal testosterone, this shit is still going on. Now, if you have low normal testosterone and you're symptomatic, email me. Go to drsteve.com, click contact, or you can just email me. I give out my email address. I don't give a damn. It's drsteve202@gmail.com. And I will send you an article to print out and take it to your primary care provider that says you should treat low normal people who are symptomatic, because when you do that, if they have quote unquote low normal testosterone, which we now know if you're symptomatic is low testosterone, that it improves their health-related quality of life, and that's all we care about when it comes to testosterone anyway.
Yeah. And I think a lot of people don't understand, too, Dr. Steve, that, those numbers on some people, 300 may be high for some people, depending on what their baseline was,
That's right.
I mean, and that's why it takes just a little bit of effort from your provider to say, well, let's look at this and see how you're doing. Because just because if it's 302 and you feel awesome and you're lifting weights and everything's perfect, you don't need it treated.
Yeah,
it is in the same token. So
yeah, that's right. That's right. If you're not symptomatic, I wouldn't treat it.
No, heck no.
If the numbers were low, that's correct.
As long as you're
that's what we're trying to do, is treat symptomatic hypogonadism.
Right.
Now, if you want to preserve fertility, you don't want to necessarily get on testosterone. If you're trying to have a kid and your testosterone is low, then you want to get on clomiphene, which Tacie was on. You want to talk about that experience?
Made me evil.
Yeah. Well, no, you weren't so evil, but when you came off of it, you were crying for 2 weeks, and every time your pregnancy test was negative, because what they were giving it to her for was to stimulate ovulation, because Tacie has PCOS. Mm-hmm. And it's like pieces of shit, right? PCOS. And so for months and months and months, they gave her a certain dose of clomiphene, and we would have to have intercourse at a certain time. Mm-hmm. And that included whether we had people over to the house or not. Or a clock would go off and say, well, we have to do it right now.
Yep.
And that was always fun. It was sort of like what I imagine medieval marriages were like, where the people had to sit outside and almost watched the king and queen consummate their marriage to make sure it was legal.
Oh, wow.
Well,
right?
It had to be done, so.
Yeah, that's what it was. It just had to be done. It wasn't for any...
It's a good thing she didn't enjoy it. It was just
any reason.
A job.
No, it just had to
be.
When it happens that quickly, there's not a lot to...
But then they doubled her dose, and then she had... then we got pregnant with Liam immediately.
Oh, wow.
Yes, but we were also on vacation, and
correct.
That was, I think, the stresslessness of it.
We highly recommend to people who are having trouble getting pregnant is go on vacation.
It works almost every time.
Yeah,
it almost
worked.
It worked for us twice.
Yeah.
The second time we were on vacation, and we didn't know it because we came back and said, okay, we're going to have another kid because Liam needs somebody to play with, which he played with him for about 5 years, and then that was the end of that.
That was the end of
but anyway, so they don't dislike each other. They just have nothing to do with each other, except now they're living literally on top of each other in college. So we're going to see how that goes. But I was looking forward to the attempt at getting pregnant again, because what that meant was clomiphene, then have intercourse, then cry for 2 weeks, and then which I could live with if the first part was happening, and then do it again until she got pregnant, and she was just getting ready to start the clomiphene, and what the fuck, she was already pregnant, and I'm like,
rats!
I was like,
no more sex for me.
Damn it!
It's over. The fun was over at that point.
Yeah, she came in and said, "Look at this," because they test you before they start giving you the Clomid, which is the appropriate thing to do, and she was already pregnant, and that had, again happened on vacation. So
that's how the streak began.
Yeah, and then the first time you were in labor for 17 hours, and it was rough, and she had to have the epidural and all this stuff. Mm-hmm. The second time, she barely had time to get the epidural, and when they got the epidural in, they said, "Well, let's check you," and she was 10 centimeters, and it was like, "Oh,
let's get this thing out of here. I got stuff."
Her
to do.
dad didn't make it, her mom didn't make it. It was like, we're having this baby right now, so. Really, Tacie she just blooped back out. She could have had 20 kids if we'd been, a frontier marm and paw.
And a little younger.
Yeah.
I pushed harder to pee.
Yeah. You just bloop, and there he was.
He just fell out.
Yep.
Okay, but let's move on.
Okay. Well, is that bad?
Enough Tacie.
Right.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
The last thing you want to hear when you need your auto insurance most is,
"Thank you for calling. Please listen to your list of 46 possible service options."
Which is why when you choose USAA Auto Insurance, you'll get great service that is easy and reliable. 24/7 online service for claims, access to roadside assistance, and more. All at the touch of a button. Start getting the service you deserve. Get a quote today. Ability to receive a quote depends on membership eligibility. Membership eligibility and product restrictions apply and are subject to change. USAA means United Services Automobile Association and its affiliates, San Antonio, Texas.
With Walmart's new fresh and frozen subscriptions, you can save time on your weekly grocery shopping.
Dad, you're supposed to be grocery shopping.
And miss the chance to embarrass you in front of your friends? I subscribe to snacks and wet napkins. You know how messy you are.
Dad!
Walmart. Subscribe to your weekly list.
Introducing our biggest GMC Acadia ever. Offering bigger screens, bigger views, and even bigger journeys. Live your biggest life in the all-new GMC Acadia.
Hear that? Yeah, that's the sound of you relaxing, because now you're managing diabetes with the Freestyle Libre 3 system. You get to know your glucose levels and where it's headed. Manage your diabetes with more confidence with the Freestyle Libre 3 system. Ready to learn more about the #1 prescribed CGM in the U.S.? Visit freestylelibre.us to learn more. Based on retail sales data for patients' last full prescription by manufacturer. Refer to the FLAIR NL4 study published in BMJ Open Diabetes Research and Care 2019. Safety info found at freestylelibre.us.
It's Tacie's time of topics. A time for Tacie to discuss topics of the day. Not to be confused with Topic Time with Harrison Young, which is copyrighted by Harrison Young and Area 58 Public Access. And now, here's Tacie.
By the way, Loganfield is in the fluid family waiting room. And that's my friend John that I went to visit in Wilmington. And we just got my Mogfest blanket back. So, John, Thank you very much, my friend. And I had a question from him in the queue, and I just realized it was from 2021. So maybe we'll play it anyway in honor for me. I think it's some damn anti-vax thing, which is fine. But I think that's probably what it is, or some vaccine skepticism from 2021, because John was quite the vaccine skeptic. Well, we'll see. Since he's here, we'll play it, and then we can either make fun of him or go, yeah, bro, you know what? You were fucking right. So anyway, what you got, Tace?
Okay, so my first article or topic is about ADHD and how there are symptoms beyond a lack of focus.
Uh-oh.
Yes.
So
check.
Here we go.
Check.
I have 13 other ADHD
Oh,
symptoms,
shit.
as well as the criteria you must meet to receive a diagnosis as an adult.
Oh, okay. Let's hear it.
have 'em.
Okay.
Okay, these
Check.
are pretty
Yeah.
disorganization,
What?
Check. Relationship concerns, such
Double.
as
I was thinking.
inattentiveness, being easily bored, talking over people in
To
conversation.
what now?
I didn't hear everything she just said.
So anyway.
What's the next
As a
topic?
person,
What's the
as a
next topic?
result, a person with ADHD may come across as insensitive, irresponsible,
Fuck
or
off.
uncaring.
And do what? No, we're doing that.
That's inconceivable.
Number 3, lack of focus, of course.
Oh, shit.
Being easily
Did
distracted.
you see that fucking thing?
We are
Who
on a
is
roll.
that guy?
Finding it hard to listen to others in a conversation.
Check.
Says I usually listen to Sirius every Saturday. This past Saturday, there wasn't an episode on the feed. What?
Oh.
Uh-oh.
Not in a baseball game on.
Oh, I bet they're preempting us again.
Number 4, restlessness and anxiety.
Double check.
Got to get the fuck out of here.
An adult with ADHD may move around frequently, tap their hands or feet, shift in their seat, find it difficult to sit
when I
still.
rock like this?
Sorry.
Yeah.
Okay.
Emotional concerns.
No, don't have any of those.
Hyperfocus.
Oops.
Often
Okay, let her
easily
do her
distracted,
thing,
but
Jesus.
they may also have something called hyperfocus, where
Now,
they
we
can
saw
get
that.
so engrossed in something that they become unaware of anything else around them.
That's how we knew our kid had it. Liam played Star Wars, Lego Star Wars. We just wanted to see how long he would go. What was he, 6?
Yeah.
And we wanted to see how long he would go, and it was hours and hours and hours. We weren't going to stop him. We eventually had to. It was
Right.
like, well, we can't keep up with it. Be on top of that.
Well, he was hogging the good
He's the
TV.
hogging the TV. Exactly right. Okay, go on.
Time management concerns.
No, I'm fine on that.
Procrastination on tasks.
Oh, God.
Showing up late.
Fuck off.
Ignore assignments they consider boring.
Check.
What about forgetfulness?
Not a chance.
He's a fucking idiot.
We all know that can affect careers and relationships. Impulsivity. Interrupting others again. Being socially inappropriate. Rushing through tasks.
Okay.
I got it.
All right.
Acting
Sounds
without
like,
much consideration for the consequences.
It sounds like this is a.
Is this a?
Is
Is
this
she
an
talking to her
intervention?
therapist?
Yeah.
Written by, I'm just kidding, negative self-images.
Yeah. Well, I am a fucking idiot.
Lack of motivation and
That's
fatigue. Physical health concerns.
Okay.
So, 'cause-
Okay. Enough.
I was 99 out of 100 so far.
Yeah. Substance misuse as well.
Now, that I don't have a problem with.
So testing
Unless
for
Celsius counts.
it, which I think for you sometimes it might.
It might, yeah.
Okay. And is perfect.
Miss wine drinker. Testing for adult ADHD.
Okay.
It typically involves at least 2 detailed interviews with a mental health professional or primary care physician.
I can't sit. I barely sit down for one, much less make it
Yes.
2.
And then you need to have,
that's not
according to the DSM-5, which is Diagnostic and Statistical Manual of Mental Disorders,
Yeah.
you need 3 ADHD presentations.
Sorry.
3. You
about
need
all
3
of
of
them?
those symptoms, yeah. And so
I was just
treatment,
looking at my soundboard and wanted to play that one.
you may want to consider cognitive behavioral therapy if your symptoms are mild, just by getting organized, stick with plans, and finish activities that you start.
I'm so fucked. And, the thing is, I'm 60
something.
However, I'm going to be 68 years old in 2 weeks, and it's a little bit late to, to
cognitive behavioral,
and I can't tolerate the medicine. No, I've done cognitive behavioral therapy. I'm actually in therapy, individual therapy right now, and she does a bunch of stuff. But what am I going to do?
Right.
I'm going to start taking Adderall now.
No, hell no.
I went undiagnosed for literally 60 years. I'm sort of known about it. And
Dr. Steve, what gave it away?
Well, dude,
it's like I look in the mirror. I'm like, oh my God, I drive myself crazy.
Yeah.
Not to mention everybody around me.
I was in elementary school. They didn't have such a thing in 1960, and so I was just an underachiever, and I was disruptive in class, and I was stupid Steve all that time. And the only reason, well, not the only reason, one of the reasons I succeeded in medical school was, and I did kick its ass, was I finally figured out how to harness it to my benefit, but it didn't change the fact that I had ADHD. I had to harness that hyper-focusing shit.
Right, you can laser focus, yeah.
But one of my classmates was he in medical school? He had already graduated and was a cardiologist. Told my best friend that Steve will never make it. And I went, okay, you know what? It's on.
The gauntlet.
It's on. And no, I don't think it is on. No, it's on. It was on. And that carried me through some tough times in medical school thinking about him saying that shit behind my back to my best friend, who he knew was my best friend.
Yep. And when she was reading through all those lists, it took me, like, when I was in second grade, I remember getting, sent to the principal's office because I refused to do the homework.
Oh, dude, I was always.
I said, I'm not going to do that same math problem 20 times. I did it once. Right. I know how to do it, and I don't have to show you how to do it.
I'm going to tell you something even worse. I never learned my my multiplication tables. I still don't know them. I mean, I kind of do, but what I learned is that multiplying times 6 is the same as multiplying times 3 and then times 2. And multiplying times 8 was the same as multiplying times 4 and then times 2 and shit like that. And then I had to memorize the sevens. I'm still a little fuzzy on those.
Sevens are hard.
But 7, but then every one of the sevens is a 2, 3, 4, 5, or 6. And everybody knows 7 times 7, 49. And then, 8 times 7 is going to be 4 times 7 times 2, et cetera. And that's how I learned that, because I was, by God, not going to memorize all these damn tables. No. It was way more fun to do it that way.
Yep.
And of course, Tacie, her dad taught her the magic way of doing nines, and that's the way I learned them too. 6 times 9, you take 6 minus 1 is 5, and then 5 plus what is 9, that's 4, 54, which actually is a lot more work than just learning 6 times 9 is 54.
Yep.
Yep. But anyway. I never learned them because fuck that. I'm not learning this. My mom had a record player. I had a record player in my room. She had records that would play, and she tried to subliminally get me to learn it at night. It would go, 6 times 3 is 18, 6 times 4 is 24, and it would sing the song, and it would go over and over, and I would hear it go, and then,
Doing it
6
all
times
over again.
1 is 6, just over and over and over again.
Oh my
it's
God.
like, God, give me a break. It didn't help.
How funny.
Anyway.
That's good stuff.
Well, it was ADHD. That's what it was.
Oh, heck yeah.
And Tacie, I apologize for being an ADHD asshole.
Yeah, me too.
And I'm sorry that you had to marry this. I really do apologize for that.
I would do it again.
Change anything. I'm still going to be impulsive and do stupid shit.
Topic number 2.
All right, topic number 2. There we go.
COVID out trial. This is a breakthrough study on a diabetic drug that helps prevent long COVID.
Oh, wow.
Oh, I did read this. This is a good one.
Metformin when taken early during a COVID infection. Now, this has not been published, but it will be in the Lancet.
And this, this is in a preprint, has not gone through peer review, I think, right?
Yes,
Is that correct?
that is correct.
So they've submitted it to Lancet. I don't know. Has Lancet accepted it yet, Tacie?
I don't know. In my little...
Okay. So
yeah,
let's
don't
just
ask.
take this with a grain of salt. It's on a preprint server. That's my understanding. But anyway, go ahead.
42% drop in long COVID with mild to moderate infections.
And they're defining long COVID as...
COVID that lasts a long time.
No. Were there specific symptoms of long COVID
No.
that they were looking at?
There were 3 oral meds that were tested: metformin, ivermectin, and fluvoxamine.
Yeah.
It was called the COVID Out trial. Blinded to randomized treatments. Trial was decentralized with no in-person contact with participants. Aged 30 to 85, obese, confirmed COVID, fewer than 7 days symptoms, no known prior infection. They joined the study within 3 days of a positive test.
Okay, I'm going to back up, and everything I said was bullshit. This thing has been accepted. It's just published online first and has not hit the print journal yet. So
cool.
That changes things.
Cool.
Okay, so this thing has been peer reviewed. It's been accepted for publication in the Lancet Infectious Disease, and it's published online first. Sorry, Tacie, go ahead.
So the monthly follow-up for 300 days, and participants told if they get a long COVID diagnosis or not. Okay. Metformin was doled out over 14 days. They had 1,323 in the study, and 1,125 agreed to do long-term follow-up. 564 in the metformin group. About 55% had received the primary COVID-19 vaccination series. 8.4% reported that they were diagnosed with long COVID. Metformin group 6.3 got long COVID compared to 10.6 with placebo. Risk reduction for metformin was 42% versus placebo. When it was started less than 4 days after symptoms began, there was a 64% reduction. The others showed no benefit. More research is needed.
Okay. So what they were looking at were any sort of symptoms that were related to a COVID-19 infection that lasted beyond a certain time. And what they were saying is most of the studies stopped looking at people after 35 days, and they looked at people much longer than that, up to day 180. So they said 1,100 completed one survey after the assessment for long COVID at day 180. I didn't hear if you read that because I was reading.
I said monthly follow-up for 300 days.
Okay.
And
All right.
participants told if they had a long COVID diagnosis.
I'm just looking to see how they defined long COVID because they had a specific definition of long COVID, and I'm trying to find what their definition was, but I guess it was just any symptoms. Anyway, I'll try to research that just so that now I know a bunch of people that have long COVID in the I see overall right. 8.3% of the participants reported receipt of a long COVID diagnosis by day 300. So this was pretty long study for this kind of study. And most of the long COVID diagnoses were made by primary care providers. Did you come across that? And I'm still looking to see how they were defining long COVID, but I think it's just any person that had symptoms like loss of
smell or taste or brain fog or something like that. They didn't have it prior to.
That were associated with the diagnosis. Yeah, that's interesting, isn't it?
Did they rule out other things like thyroid or testosterone or stuff?
I mean, they said there's selection bias in that individuals who choose to enroll in clinical trials and complete 10 months of follow-up might not represent the general population. You'd think they're all the people with hyperfocusing from ADHD. Tacie, do you want to talk a little bit about what metformin is?
No, not really.
Oh, that's fine.
I mean, I did my topic time. So that's pretty much all
Metformin is a diabetes drug. Let's just say that.
And it's brand name glucophage.
Yeah, and it's very commonly used in diabetes. So they also said they excluded groups at low risk for severe COVID-19 and adults with a normal BMI and those who are younger than 30 years old. Whether those findings would be generalizable to those populations remains unknown. So this is an early study, but you know what the hell? The problem with just throwing everybody on metformin is there are some adverse effects or possible adverse effects from that, including low blood sugar.
And GI adverse effects.
Yep, and shitting yourself and, flatulence and that kind of stuff. But also, they don't know, I don't think they know what the proper dose is. So if they want to look at this, now what they got to do is do a prospective study on metformin alone, saying we're going to do placebo versus 100 milligrams or whatever, 25 milligrams, 100, 300, and try to find the right dose for this. Above this, we had no perceived benefit in long COVID, but we had more side effects. So, and then they can kind of narrow down what the dose is. That's pretty cool, though.
Cool. Good stuff.
You done with that?
Yes, I have one other topic that's really boring.
Yeah,
so
no, it's not boring.
Do it.
No, do it.
All right, here we go then.
Yep.
You asked for it. Go
Yep.
potty. Both intermittent fasting and calorie restriction may benefit the gut.
Oh, okay.
But gut bacteria in the microbiome are important to a range of health-related processes in the body, and a lack of diversity is tied to more diseases. There are several so-called blue zones in the world, one in the United States, areas with extremely high rates of people who live past the age of 100 years old. So, intermittent fasting. A new study from the University of Colorado's Medical School highlights how changes in the gut microbiome brought about through dietary interventions can influence gene regulation and overall health.
Really?
So, participants in this study, all whom have either overweight or obesity, were instructed to fast for 3 non-consecutive days each week for a year. And an earlier analysis found that the diversity of gut bacteria in individual microbiomes was significantly improved, even at only 3 months into the year-long study.
No, I'm just kidding. I'm just kidding.
No. I
So
told
what they
you
find
it's,
out?
it's not
You
a
were
good.
right. You were
I'm
right.
having trouble coming up
I should
with
have trusted you.
topics.
No. Just, you know what? All you got to Google dick nuts,
I
balls.
don't want to always do that.
Wait,
though.
okay. All right. Go ahead.
So anyway, if you're going to fast or you're going to do calorie reduction,
yes.
apparently it helps your
Might help.
microbiome in your gut.
And that would lead to improvement in what? Are they saying cardiovascular disease or just how you feel or what? We don't know.
I mean, it's in here
Yeah,
somewhere.
you were right. I'm sorry. I shouldn't have pushed you to do this one. I was thinking we might just use this one to play us out, but it's okay.
Yeah, okay.
Okay, yeah. All right. So intermittent fasting might be good for the gut and will to be determined whether there's any significant benefit to your overall health.
I'll try to make the next one about a penis.
Well, yeah, you could throw a penis in there every once in a while.
Yeah.
All right. Let's see. Let's do John's phone call. Let's do John. See, this is 2 years later. Is this complete horseshit? Because this is actually 2 years and 2 months later. That's how old this voicemail is. We'll see. Is Loganfield still in there?
Hey, Dr. Steve.
Okay.
Long-time listener, first-time caller.
Okay.
No, I'm just kidding. I've called you a few times before. This is Loganfield in Wilmington. I had just a quick question, comment, whatever you want to call it. I know there's a lot of people out there who are not getting vaccinated. They're choosing not to be vaccinated, and a lot of their family members.
I'm assuming he's talking about for COVID-19, not for measles, mumps, and rubella and that kind of stuff.
Are not, I guess, happy with that and possibly a little freaked out about it.
Oh, yeah, we had all kinds of people like that. We had people that were not vaccinated that were not allowed to go to family reunions and stuff like that during this.
Because of the fact that they're not being vaxxed and they think.
And Stacy DeLoach, if you remember, he caught a lot of hell, and I caught a lot of hell for his prank that he pulled with, a counterfeit fake or, vaccine card. But the point of that was that if you had a concert where you made people bring a vaccine card for $100, that was the premise. The $100 you'd get a fake one. That did not protect you. No, that didn't protect you. So anyway,
I think that they are vaxxed, and
right.
they think that just because that person isn't vaxxed, that's going to make it more dangerous for the person who is vaccinated or.
Right, and that's another question is, Jimmy Dore always said, listen, if you want to wear a mask and you want to get vaccine, well, you're protected. So what do you care if I have one or not? If you believe that the vaccine, which, of course, we know the vaccine is perfectly effective and prevents transmission of disease and hospitalization and death. That's for the YouTube algorithm. If you have done all those things, you're protected. What do you care if somebody else does? Now, I've kind of come around to some of this in the sense that I'm not a fan of mandates. I never have been. People go, well, you're a shield for the vaccine company. I say, are you aware that I was against mandating vaccines from day one? And they're like, no. And it's like, okay, well, then we're cool. I was in favor of therapeutics from day one. And I'm still wonder what the hell happened to favipiravir. I see we have molnupiravir on the market with its 30% reduction in hospitalization compared to, say, early IV remdesivir or Paxlovid for people at high risk. And that's for people at high risk. But I'll tell you what molnupiravir is awesome for. If you're not at high risk and you can get your doctor to prescribe it, it'll make you feel better in about a day. So that stuff is the bomb for symptomatic relief. Just don't assume that it's going to be great for keeping you out of the hospital if you're at high risk. But if you're at high risk, you should be doing early remdesivir, or you should be doing Paxlovid or whatever. I'm a big fan of that. But what the hell happened to favipiravir? June of 2021, it was out there. I was talking about it on my COVID sit reps, and it just kind of faded away. Fuji had this drug that was... anyway, I'm getting into the weeds on this, but Fuji had a drug for influenza that was very promising for SARS-CoV-2, and it just kind of never went anywhere. And I'm not sure what happened there, because the next thing we knew, we had Paxlovid. Well, it wasn't the next thing we knew. A year later, we had molnupiravir and Paxlovid, and we had these antibodies that worked for a while and then didn't work, and now we're just not even bothering with the monoclonal antibodies anymore. But anyway, so yeah, it was a scary time, and I know where John's going with this. Unfortunately, brevity is not his strong suit. But
or even if the person has had coronavirus.
Oh, for fuck's sake, yeah. And at that time, we weren't paying attention to natural immunity either, and we thought at that time that the vaccines were perfect. Because we were told that. Yep. We were told if you take the vaccine, you can go look at the videos from back then. If you take the vaccine, you won't get it. If you take the vaccine, you won't be able to transmit it to anybody. Now, does that make me an anti-vaccine person? Hell no. I'm taking the vaccine. When the booster comes out, I'm going to take it. Knowing that there's some risk, but there's more risk to me if being 67, 68 years old, if I don't take it, in my opinion. So, so it's your choice. Don't try to mandate something that hasn't been approved by the federal government. That's my issue that I have, is that the FDA never approved these things. If they do, then we'll have a discussion. And when I say never approved them, I mean, they're approved under emergency use authorization. But, I'd like to, the FDA is a very deliberative body, and they're not going to approve something until they are, by God, ready to do so, which is why thalidomide never hit our shores, which is why I am still a fan of the FDA, despite all of the criticism that they've gotten, because they are, very deliberative, and we'll just see, yeah, there's adverse effects to everything, but you got to weigh the risk, benefits, and alternatives to things. In the end, at the very end of Delta and beginning of Omicron, when things started to calm down, what we were seeing is everybody in the ICU was somebody that was unvaccinated. There's no doubt about that. So and they were all people at high risk that had not gotten the vaccine. So I still, and most of the people who are critical of the vaccine still will say, yeah, if you're at high risk, the vaccine is for you, because the benefit outweighs the risk of the vaccine at that point. What they're not in favor of is mandating that, school-age children get it until we can see that there's a clear danger from the virus that's greater than the risk of the vaccine. Anyway. All right?
All right.
Can't believe it. Thanks a lot, John. We're
Thanks,
still
John.
brought us back to this
Pain and suffering.
Anyway. Yep. Anyway, that's an old phone call, but still brings up some old emotions about that, doesn't it? Anyway, okay.
Yeah.
Well, listen. Well, thanks, everybody, for joining us today. I brought up the wrong script, so let me say thanks always go to Dr. Scott. Thanks go to Tacie. Thanks to everyone who's made this show happen over the years. Listen to our Sirius XM show on the Faction Talk channel, Sirius XM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. when we're not preempted for sports, on demand, and other times at Jim McClure's pleasure. Did you have another question from the Fluid family before I get on here?
No, we can do it Saturday.
You do? No,
Yeah.
let's do it now.
We're
not doing one Saturday.
Oh,
This is
okay,
it.
yeah. We'll do it right now.
Yeah, we'll do it now. Okay.
Let's do it live.
Hey, Dr. Scott.
Fuck it, we'll do it live.
Do it. Hey, Dr. Scott, Dr. Steve.
Hey.
I had cataract surgery a week ago.
Hey, congratulations.
Yeah, so one eye.
Best thing my dad said he ever did was have a cataract surgery.
Yeah, well, it'd be interesting. Well, yeah,
Okay,
we'll
go
talk about
ahead.
that. Yeah. Now I realize the yellow is gone. Didn't realize yellow was there to begin with. But something is
Yeller in your eyes.
something really weird's going on.
Okay.
Is it possible that part of the reason we develop cataracts is an evolutionary development to keep our retinas and our optic nerves from being damaged over time, to kind of similar to sunglasses? When I got my new lenses, everything is so bright, I'm having to turn down the screens down to dim.
Yeah.
TVs, cell phones, computers, and just normal lights are all a little too bright now. I'm pretty sure my brain will adjust. Just wondering if that's an evolutionary trend.
I don't think so.
Yeah.
The reason I don't think so is because we never lived that long.
Well, that's what I'm wondering is if as you live in it, just kind of keeps so much light from coming through to keep your retinas from
the light
being damaged. I don't
sensitivity
know.
is coming from dryness because you've got inflammation in your eye from them ripping out your old lens and putting a new one in.
Well, what they were talking about, he said they have different lenses now, like high definition lenses that cost $3,000, or regular lenses $2,000, and so all that stuff. Yeah.
But this is your vision should be clear, which it is, and it may take weeks for your eye to settle down and start lubricating again and the iris to work properly. What I recommend is don't fight it. Use sunglasses.
Right on.
When you're outside, use sunglasses. I'm sure they told you that. But and then avoid direct sunlight for the first couple of weeks until it settles back down, and do exactly what you did. Turn the blue sensors down, or turn the but I don't think that it's an evolutionary thing to protect the eye. I think after you have surgery, which evolution did not prepare us for,
right? Exactly.
That your eye is just very sensitive because of the inflammation in the eye.
Cool.
Yeah, but that's an awesome question.
Great question.
And my dad had cataracts in both eyes, and he said the greatest thing he ever did was doing that, because now he could see clearly. Again, he didn't realize how bad his eye was.
Right.
You lose resolution for the most part when your eyes or the lenses get cataracts in them, and it is caused a lot of times by ultraviolet light. Right. And, you get these spots on the lenses, and the brain can control for that, but you will lose resolution. And so that's what I'm noticing, is that I have decreased resolution when I read things. and I have to, squint a little bit more and those kinds of things. And when you really know you need to do something is, two things will happen. You will be driving, and the street lights will have halos around them, and that's light refracting around these spots on your lenses. Just like when you see a picture of a star through a telescope, you'll see those refraction lines that are really what you're looking at is light refracting around the struts that are holding the secondary lens. Okay. In the middle of the mirror, and you'll see those lines. And stars don't really look like that. They don't really have 6 or 4 white lines around them, but they will when there's nothing you can do about that when you're using that kind of telescope. And the other time that you'll know you need to do something is when your ophthalmologist looks in your eye and goes, "Oh shit!" Wow! And then you need to have your cataracts removed.
Right on.
And but yeah, that should get better. Use the eye drops they gave you to lubricate your eye. I really like the Cystane Ultra. Okay. That's my favorite, but they may have told you other ones to use, and that really should help quite a bit.
Cool.
Okay.
Well, thank you, Dr. Dave.
All right. Well, thank you. And that's an excellent question. Are you done with questions over there?
Yes, sir. I think we're wrapping it up.
Okay. All right. Well, listen, again, thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks.
Goodbye, everyone.
Bye, guys.